Your pelvic floor is meant to be dynamic, which means contract when it needs to contract, jumping, coughing, sneezing, and also relax when it needs to relax. So these are things like urination, intercourse, tampon insertion. And with the Emsella treatment, the amazing thing is, as we strengthen the pelvic floor, it also allows it to relax when it's not contracting, because we're building that mind muscle connection, which is something you can't get anywhere else. Now, I'd love to teach you a few ways to incorporate that new mind muscle connection with your new dynamic pelvic floor to make this so simple for you and improve your outcomes. So, the first exercise we're going to talk about, it sounds super simple, but it's not quite easy. It's just diaphragmatic breathing. What I want you to do is not think about your core as your six pack abs. I want you to think about it as an entire cylinder. The top of our pop can is your diaphragm. The bottom of our pop can is our pelvic floor. As we're allowing that pelvic floor to be more dynamic, we also need the diaphragm to be dynamic as well. If you're someone who's in this open scissors position with a pelvic tilt, that's where that abdomen applicator can become super helpful to activate your lower abs. But what we're going to practice today is a way to allow your core to expand and support you. So the easiest way to first relax your pelvic floor is to take gravity out of the equation. So I'm going to be laying on the floor, and I'll ask you to do that as well. And I'm going to kick my feet up on a chair. You can on a chair, couch, coffee table, etc. And we're going to practice some diaphragmatic breathing to relax the pelvic floor. Times that people need to relax the pelvic floor, again, are things like urination, defecation, intercourse, tampon insertion. And I see this a lot in women who have to go to the bathroom really frequently. If our pelvic floor is not allowing our bladder to void all the way and we still have some urine left in our bladder, then it just has this much to fill. We have to go again. It fills, we have to go again. So if we can, now we have our mind muscle connection with the Emsella treatment. Let's relax the pelvic floor to void fully. Actually, practicing this on a toilet is also super easy because it's a time where your brain knows, oh, I have to relax. And this is going to become second nature for you. So, diaphragmatic breathing is important because as women, we have been taught to suck our belly button into our spine and our chest up. Now, this is not only super uncomfortable, but I kind of look like a weeble wobble, right? Like I don't have stability. This is stable, okay? So let's work with our core as a full 360-degree breath. If you still can't activate those lower abdominal muscles, again, we have the abdomen treatment for the complete pelvic protocol. What we're going to work on today is breath work to relax the pelvic floor. What I want you to first do is just let it hang out, okay? You are no longer sucking it in all day. The only times it's acceptable to suck it in are if you're wearing a swimsuit, a cocktail dress, or you're having your photo taken, okay? So lay on the ground here. This is what we're going to practice. I'm going to kick my feet up so I'm in like a tabletop 90-90 position. Hopefully you can see me here. And again, this is what sucked in looks like. There's space. I want my back to be flat on the floor, which brings my rib cage down. I tucked my tailbone, and now I'm breathing. Put one hand on your belly, one hand on your chest, and take a deep breath in. Notice as I breathe in, I'm only breathing in to my abdomen hand. My chest hand does not move. When you were taught to suck it in the whole time, it looks like this. And that's not what we're doing anymore. So the next thing I want you to think is that belly is expanding 360 degrees around a full circle. So not only is my belly expanding when I breathe in, my pelvic floor is expanding as well. So when I breathe in, I relax the muscles that I would use to stop my stream, and my pelvic floor drops with my breath. And now I contract those muscles and I zip up. So to relax your pelvic floor muscles, I like to think Squeeze like you're shutting off your stream and shutting off your poop, and think about those muscles, and now let them go. Great. Let's do that again. Hand on your belly, hand on your chest. If you can't feel your pelvic floor muscles, place your hand on your pelvic floor. Take your breath in, and both hands should be rising. That's an exaggeration there, but that's what you should feel like on your breath in, breath out. Now, you can practice this again while you're having to urinate or pre-intercourse, pre-tampon insertion. Using that diaphragm breath will allow your pelvic floor muscles to go from being constricted to relaxed and stop sucking it in. If you need help activating the lower abdomen muscles, that's what we have that abdomen applicator for, with the same technology that exists in our Emsella treatment. If you have other issues with your lower back or maybe your hips also having pain, this is something that I'd like you to book a chiropractic treatment with me for. We can talk about this in a chiropractic treatment as well. And I'm just excited to help you have a more dynamic pelvic floor. The Emsella treatment has allowed you to contract when it needs to contract and now relax when it needs to relax as well, with that mind muscle connection.